Good afternoon. I'm Larry Holsey, Director of Municipal Information and Communication for the City of Waco, and I want to welcome you to our press conference this afternoon. Today we're again doing this press conference virtually. We are in the third floor conference room here at Waco City Hall. We have barely, 5 people here, and most of us are wearing our mask. I've taken mine off since I've sat here so that you better understand me, and it also helps not fog up my glasses, but I normally try to wear this wherever I'm moving around with the people. But we're glad that you've joined us today. We're going to continue social distancing. We are providing the American Sign Language interpretation by way of our studio downstairs, and we're also providing a full, in-depth Spanish translation of this. That's going on while we're recording this, and we'll be replaying the full replay of this press conference in Spanish this afternoon on our cable channel right here where you're watching this today at 4:30. And to help us communicate that to our Spanish listening and viewers, we have our City Council Representative for District 2, Hector Sabito. Councilman, would you please invite the Spanish speakers to our afternoon press conferences later on?
Absolutely. Thank you, Larry. Para ayudar a nuestros ciudadanos que hablan español a saber lo que se dice durante esta conferencia de prensa, un traductor está grabando una traducción en español en vivo durante esta conferencia de prensa. Esta grabación completa en español reemplazará el sonido del inglés en el video y una versión en español de toda la conferencia de prensa se reproducirá en el canal de cable de la ciudad de Waco aproximadamente a las 4:30 de esta tarde. Puede ver la conferencia de prensa en el canal 10 o por internet en vivo en wccc.tv. Thank you so much.
Thank you, Councilman. Appreciate that. Joining me again today are our 3 representatives and specialists in becoming very common to this press conference. We thank you for that. We have our Mayor, Kyle Deaver. We have County Judge Scott Felton, and Dr. Jackson Griggs, who is the CEO of Family Health Center and the Vice Chair of the Waco-McLennan County Public Health District. Well, welcome, gentlemen. Let me outline again how we'll do our press conference, the same as we've done before, but make sure everybody at home understands what's going on. First of all, I'd ask each of you to make an opening comment, maybe something that's on your mind or heart that you wanted to share first. Following by that, I'll read questions that I've gathered through the community and through the last week or more since the last conference, and present that to the 3 of you for a response. And then following that, then the mayor will open the line for the 4 representatives that we have on the phone right now from the various media locations. And then we'll let each of you wrap up with a closing comment. So that's kind of what we'll do. So let's start off right quick. Let's go ahead and start with opening comments start with our mayor, Mayor Kyle Deaver.
Thank you, Larry, and thank you to everyone who's joined us here today. Dr. Griggs will give the latest information, detailed information regarding our local situation and our testing in a few minutes. But I'd like to show you a few slides. A couple of these we used last week, but you couldn't see all that was there. So if I could get the first slide up, please. This shows where we are in terms of COVID-19 cases in McLennan County. The red line is the cumulative number of cases, whereas the gray line is the active number of cases. The yellow line shows recovered cases. We are currently at 6 active cases, which is just remarkably low for our county our size. We were down to 4, but we picked up 2 new confirmed cases yesterday. As of Sunday, the next smallest number of cases in the county with over 200,000 population was Nueces County, where Corpus Christi is, and it had 48. So we were less than we were at 4, and they were at 48 at that point. We could move to the next slide. This is one of the things that the governor has said he is going to be looking at is hospitalization. I'm sorry, go back to the second slide, please. Is where we are in terms of hospital capacity. That was one of the main concerns that led to us issuing the shelter-in-place orders back in late March. As we have done very well here in our county, our hospitalization has never reached any kind of critical stage. At most, we had 8 hospitalized confirmed COVID-19 cases, and at worst, we had a couple of times we had 5 of our ICU beds filled with COVID-19 cases. That has not been the case everywhere. And just down the road in Brazos County, over the Easter weekend, one of their hospitals did reach capacity. They didn't all reach capacity, but they were all getting close. And, this was, those that think this wasn't a real thing and isn't a real thing, you just need to look around a little bit and you can find examples where things have not gone nearly this well. If we can go to the third slide, please. The other thing that the governor said in his press conference that he was going to be looking at, this was at his press conference on April 27th when he opened the first round of businesses, was what he called the positivity rate. And that is the total positive tests divided by the total tests given in a day. This is that data for McLennan County, with the blue bars being the tests that are given each day and the red line being the positivity rate. If we could move to the next slide, please. The problem with looking at it on a strictly daily basis is that there is a lag between the time that the test is taken and the date that you get the results back. And also there's a lot of variability from day to day on how many tests are given. So a rolling 7-day average like this helps to smooth that data out and makes our data a whole lot more readable. So again, the blue bars represent the tests that are given each day on an average basis, and the red line represents the positivity rate. You can see that when we started 7 days into testing, we were only averaging about 10, a little less than 10 tests per day. At this point, we are averaging over 130 tests per day, and that number is climbing steadily. We got over 9%. That number is on the right side of the axis on the right. We got over 9% a couple of times with our positivity rate. We are now down below 0.5%, which is just almost unbelievable, to the point that I'm not sure I do believe it, but it's really, so far we've done very, very well. So let's talk about where the state is. If we could go to the next slide, please. When the governor held his press conference on April 27th and talked about this, the state was at about 6.7% positivity. This data only goes back to April 5th. That's as far back as we can go with the state's testing data. But you can see that the tests are generally going up. And let's go ahead and go to the next slide, which is the rolling average of the state, because that also makes it easier to read. You can see that the state's average testing is generally going up, and we have gone from about 6.7% of the day that he announced the openings to just a little over 6%, and are staying steady that so far at that point. We have been reopened now for 12 days, and the guidance was to wait 14 days before you take the next step. The governor did take a next step when he opened up salons and spas and a couple of other businesses in the interim. But you can see that so far we have not had a big rise statewide. Some of the bigger cities and counties have had pretty significant rises, but statewide we're still doing pretty well. So we expect the governor will make more announcements this week, and probably will open some more businesses beginning on Monday. So we would expect to hear from him tomorrow or Friday on that. If you could take the slides down now. What does this mean for us? Again, the state is just above 6%, and we're below 0.5%. What that tells me is that our citizens, for the most part,
automatically end in 5 minutes.
Uh-oh.
Sorry about that.
Okay. Our citizens, for the most part, have done a fantastic job of following the orders and the guidelines, but we can't be lulled into a false sense of security at this point. It would be a false sense. The virus is still present. It's not going to go away anytime soon. It's not going to go away until we have vaccines, which aren't going to be here for a long time. And so in order to continue to do this well, we've got to continue to follow the physical distancing guidelines and hand washing and hand sanitizing guidelines, and wearing masks or face coverings when we're around other people to the maximum extent that we can. And I'm sorry, I don't like it either, but that's the new normal that we're facing for the foreseeable future. And I just want to thank everyone that has been doing such a great job to get us to this point. I'll turn it over to Judge Felton.
Okay, good afternoon, everyone. As you hear, the numbers are good. We're very proud of that. And I think we ought to, all be happy about it. There are concerns out there, but, just in our county, there's things that, there's areas that are hot spots for other counties that aren't for us. So far, we haven't had any cases in our jail, where we have a little over 1,000 inmates and right at 400 guards and administration people there. Also nursing homes. We're very proud of how the nursing home administration of the different entities have done a really good job and kept the virus out of their nursing homes, which is a tinderbox for the problem, and very bad outcomes for those people in nursing homes because of their age and our condition. Shelter in place has been an effective tool. Shelter in place is still part of the order. It's just that there's more areas that you're able to go into that are have been made available to by the latest order of the governor. Going forward, for us to really not have to go backwards is to stick to a lot of those basic standards of social distancing, as the mayor said, as well as wearing masks when you're in public areas, protect others, be responsible yourself, and that'll do a big part of keeping us in good stead with the numbers. Also, surfaces, we've learned a lot about how the virus can be transferred through surface contamination. And so I think people are more aware of that. And you can tell by the amount of Clorox wipes that have sold through the area. That was a good stock buy the way. I think people have learned a lot through this. And so I look forward to moving forward cautiously. I really ask the public to watch the numbers like we watch them, and try to know as much as we can about it. So thank you. I'll be glad to answer questions here in a minute.
Dr. Griggs?
Thank you.
Okay, thank you. As I have done in the past, I'm just going to review numbers. I appreciate the mayor's description of positivity rate and where we are as compared with the state. Let me start globally. There are now more than 4 million confirmed cases worldwide, 286,000 deaths. In the United States, we have 1.3 million confirmed cases and a little over 80,000 deaths. The Texas Department of State Health Services reports 41,000 reported cases in Texas and 1,133 deaths.
Automatically end in 30 seconds.
We apologize. We're trying to figure out what's going on.
I'll just continue, and if we get cut off, we'll
No.
reconvene.
That's the media.
1,133 deaths in our state today.
All participants are now unmuted.
In McLennan County, the update for this afternoon is that we have a total of 96 confirmed cases, 6 of which, as the mayor mentioned, are currently active. And we're celebrating because we have no hospitalized cases of COVID-19 currently. The health district is monitoring 40 individuals, and to date, there have been no new deaths, so the current total is 4 deaths. Regarding testing, the total tests, and this is as of May 11th, we have had 4,570 tests performed in McLennan County, and this does include the 226 tests that were performed Friday, May 8th by the Texas Guard at the Belmead Civic Center and at Waco Fire Station number 5. Those results, incidentally, are still pending. You heard the judge mention that we have not had any confirmed cases in McLennan County nursing homes, and there are no new confirmed cases among first responders, so still only 2 to date. And of note, the Texas Guard is planning to return this Friday to the city of West to host another community testing day. I don't have further details on specific arrangements, but stay dialed into news media to find out when that will occur.
Okay, very good. Thank you, gentlemen. Well, let's go with the questions we've got. I got a number of them, and we'll try to move through as quickly as possible. Kind of very much on the subject, Dr. Grizz, you just talked about. Even as the governor orders testing in all Texas nursing homes, local nursing homes have yet to report any confirmed cases of COVID-19. What are our local nursing home staffs doing to such degree that we're obviously protecting some of our most vulnerable residents?
This is a really important question because a couple of weeks ago, the Dallas Morning News reported that over 40% of the deaths in the state had been in long-term care facilities. So you've heard me commend the performance of our local health district, and this is another instance where I would like to really just praise Dr. Gray and her team. In February, the epidemiology team in the health district began reaching out to long-term care facilities. So in February, that was before we had a single case in Waco, and began providing infection control practice guidance to the long-term care facilities. Where there were personal protective equipment and hand sanitizer needs, the Emergency Operating Center provided those to long-term care facilities. And the long-term care facilities deserve, I think, a strong commendation for their outstanding conscientiousness. Again, a little more than a week before the disaster declaration and the shelter in place, skilled nursing facilities and long-term care facilities in our community had implemented restricted access policies. And so, again, preempting incidents in our community, they began taking protective measures and have continued to be obviously fastidious in their care, hand washing and PPE, and protecting the residents.
Okay. Council members Andrea Bearfield and Hector Sabito have sought to warn the high incident rate of COVID-19 striking persons of color. During their town hall meeting last week, someone asked how many confirmed cases in Waco involved minorities, and none of the panelists knew. Here we are a week later. Do we know the answer to that yet?
Yeah, I can take that. And that data has been available for a while. It's on the covidwaco.com website under demographics. And I think they probably just forgot that in the moment of their press conference, their call-in show last week. But the numbers are this: 55% of our confirmed cases have been white, 21% have been black, non-Hispanic. The first number was 55% white, non-Hispanic, 21% black, non-Hispanic, and then 11% white with Hispanic ethnicity. Then there are 3% other and 10% unknown. And we're working on trying to narrow that 10% unknown down. In McLennan County, we have 55.6% white non-Hispanic population. So that number is almost dead on with our population number. In the black non-Hispanic, we have a 14.9% population. And so it is about 6% higher. The positive rate was 21%, or the confirmed cases were 21% higher. 21% black. So that one is higher. The Asian number is part of the other, I believe. Hispanic, the demographic is 26.7% of our population is Hispanic, and only 11% of the confirmed cases are Hispanic. So this is really an important factor, and something that we want to continue to track. This has been a real problem in certain places across the nation. And we want to be sure that we are being equitable in our healthcare One of the things that we've asked the hospitals and Dr. Griggs has checked on is how are we doing in testing? Are we giving tests at about the same rate to all of our races and ethnicities that we are to the demographic population? And we've checked it several times, and we are always within 2 or 3% of being right at the same ratios. And so I think that's really important. It demonstrates that our health systems, including the Family Health Center and our hospitals, are doing a great job of being sure that there is no discrimination in the way that we're handling the testing.
Okay. Next question. What businesses and services will be allowed to reopen on Monday, and at what capacity? And are there going to be changes in recommended gathering sizes?
Judge, will you take that?
Yes. Well, we actually have no idea of what the governor will roll out. I think it'll be more opening. I think with economic recovery being one of his leading initiatives, more than likely the percentage of occupancy may be moved some, but other than that, I'm not exactly sure what will be rolled out. I don't think that he or the state would require wearing masks, but I think that it will be strongly suggested, and as we would too as well. So,
Thank you, Judge.
Okay. This is kind of on the subject we've already talked about a little bit, but Governor Abbott has called for coronavirus testing of all nursing homes and senior adult living centers. Who will do that in McLennan County, and over what time period? And just more about that.
I can answer that.
Thanks.
The state has not announced how they're going to manage the logistics, but as far as we know, it'll be the state who operates that, and we don't know when that time will occur yet. Again, the state hasn't announced it. Regarding the specific numbers, we have 28 long-term care facilities in McLennan County, and that accounts for 2,416 licensed beds.
Okay, this is for you, Dr. Riggs. How do you interpret the relatively moderate number of COVID cases in McLennan County and the low number of hospitalizations? And if those numbers remain somewhat stable while testing numbers go up, what would that mean?
I interpret it with joy, Larry. With great delight and with hope for the future of our community. I think as a clinician, what the numbers mean is that there has been low incidence or occurrence of the disease and a relatively low prevalence, which means how many people at a given time have the condition. And I think this is due to two protective factors, one being innate factors in our community and the other being actions that have been taken. Those innate factors in our community are that we have, relative to some larger urban centers, we have a relatively low density of our population. We don't have major mass transit system like a subway, and we don't have a high degree of international travel compared with some of the cities that have been harder hit. But then on the other hand, the actions that have been taken also account for a large reason why we have not seen the kind of incidence and prevalence that other urban centers have seen. Again, I say this even when they're not in my presence, commend our city and county leadership for their early decision to shelter in place. I think that was very, very important. Also commend our school leadership who closed schools early. And now we're reaping the benefits of those hard decisions that were made, I know, with fear and trembling, even before the virus had arrived on our doorstep. It also, I think those low numbers also reflect the degree of care that our community has implemented physical distancing protocols, keeping 6 feet from each other, and it reflects the excellent contact tracing that our health district epidemiology team has implemented. Again, contact tracing is about identifying who the close contacts are of confirmed cases, quarantining those individuals, checking in with them on a daily basis to make sure that they're not showing symptoms of the disease. And then I think finally, it represents the conscientious care and testing that's been done by the healthcare facilities and like I mentioned before, the practices of the long-term care facilities in our community. It feels like we have won this first round, but there are many more rounds to fight.
Back to you, Dr. Griggs. I mean, the Episcopal Health Foundation recently announced $1.6 million in grants to 23 nonprofit clinics and other organizations in Texas for the COVID-19 work with at-risk communities. The Family Health Center, which you're the CEO of, is designated to receive $100,000 according to the press release about announcing grants. What will that funding go for?
The Episcopal Health Foundation has been an excellent partner for the Family Health Center and then to Waco. Their interest is in health, not just health care. And so while they're taking care of the needs for those who need health care, particularly among those who are socioeconomically disadvantaged, they're also interested in population level health. This particular grant, I think, reflects, the Episcopal Health Foundation's willingness to find out where the need is and meet it when a crisis occurs. The Larry Green Center is kind of a national think tank for primary care, and they have reported that 40% of the national sites that they have surveyed across the country in primary care, 40% of sites have laid off staff, and around 3/4 of primary care sites that they have surveyed are seeing greater than a 50% decrease in patient volume. Early in the pandemic, the Family Health Center and other primary care sites in our community pivoted to only doing essential care. So that was care to keep people out of the ERs and out of the hospital, but postponed a lot of chronic disease care, vaccinations, et cetera, in order to kind of clear out the waiting rooms and keep people from getting exposed to the virus, particularly when so much less was known about the virus. There was so much more uncertainty early on. While we've put processes in place to begin to see patients in a safe way, those with chronic disease, children who need vaccinations, women who are pregnant, we still have, over the past 8 weeks, had about half of the volume of the care that we are built to serve and have done in the past. That has very real revenue implications, and so the $100,000 grant from the Episcopal Health Foundation will allow us to maintain our staff in a moment when our revenues have dipped substantially. It'll also help us lay the foundation for a pharmaceutical delivery program that we're really excited about, so that in certain cases, patients won't have to pick up their drugs from the window, but we'll be able to deliver those medications to them.
Thank you, Dr. Griggs. I appreciate you answering that. And I want to say, echo your words about the Episcopal Health Foundation. Elena Marks, the CEO of the foundation, their board and staff have been just incredibly helpful to Waco, and we so much appreciate that foundation.
Okay, we're talking about opening and closing. Things are happening. The dates are changing. What's expected to remain closed at partial capacity until June the 1st, and what will change at that time?
Larry, I see that as being similar to an earlier question, and that really all depends on the governor. I mean, the governor has taken charge of this reopening. He has made it clear that neither cities nor counties can make things either more or less restrictive. And so we will be opening our facilities, the city's facilities, in accordance with his guidance. And when we feel safe, and I could talk about that more with opening our particular facilities. But for businesses and others, it's going to depend on what the governor says.
Okay. A key element in slowing the impact of COVID-19 is getting a preventive vaccine. Various stories pop up in the news about the development and testing of a vaccine. What are, Dr. Griggs, this is probably for you, what are you hearing regarding the status of COVID-19 vaccine, and who's going to determine the standard of the effectiveness of that?
Well, there are over 100 vaccines in early development right now, and it is reasonable to assume that more than one of those will end up being successful. We're 40 years into the HIV epidemic, and we still don't have a good vaccine for HIV. But there's reason to be hopeful for a vaccine for the coronavirus. And so I want to share with you some of the reasons we can be hopeful. One is that in coronaviruses, particularly in farm animals, there are vaccines that are successful. I think calves have a diarrheal illness, and they get a bovine coronavirus vaccine to help keep them healthy. The second is that both in the SARS coronavirus 1 back in 2003 and the SARS coronavirus 2, which is the novel coronavirus that causes COVID-19, the human body has a fairly robust immune response to the infection, and particularly to that spike protein that gives the that round coronavirus with all the little projections coming off of it. The body forms antibodies to those spike proteins, which gives us a good target for creating a vaccine. And then thirdly, people get better. The body has a good immune response to the coronavirus, and the vast majority of people are able to eradicate the virus in their body. Again, unlike the HIV virus, people are able to destroy the virus and get rid of it, which again creates hope for a successful vaccination. Of course, a vaccine for billions of people has to be safe, and so researchers and developers can't cut corners. It's really important that the usual processes are carefully executed before a vaccine for billions of people take place. But once the science piece of things has been shown to be successful, then of course there's the manufacturing of a vaccine for billions and billions of people, which is its own sort of equally Herculean task. Just the medical glass alone for all of the vials for the vaccine is a sort of major undertaking. So there's some big hurdles, but the worldwide scientific community has a kind of unity in this that is unparalleled. In terms of who approves a vaccine in the United States, the FDA Center for Biologics Evaluation and Research is the specific agency that's responsible for vaccine regulation in the United States.
Okay, very good. Okay, this one's for the mayor and the judge, possibly. The governor's plan has suggested that starting next week, May the 18th, he could allow higher percentage of occupancy at restaurants and other businesses. Pending his official announcement, what guidance or requirements can the two of you ask or place on our citizens to prevent an upsurge in the number of cases we have in McLennan County?
Judge Felton, would you start that?
Right. Well, the restaurants have had an opportunity to have a start on this and have found what works and where the challenges are. Obviously, one of the reasons the governor would want to increase that number is to have a larger economic impact, try to save those restaurants. I doubt that 25% occupancy is going to generate enough revenue to keep them profitable, but 50% will. But it comes with more risk as well. And so they're going to, I've got confidence that our restaurants here will make every effort to be safe. But as I've said many times, it's up to us as individuals to be the judge of that. And don't put yourself in a place where you have a high risk of attracting the virus. So, look at the landscape, understand what the protocols of restaurants are if you're going to go there, and only go do business with those folks that really care about you, and then that way you can care about them. Thank you.
Yeah, I agree with that, Judge. And there is a resource for businesses that is on the covidwaco.com site under the resources button and then business resources. That is a toolkit that Johns Hopkins University put out for how to tell what category your business falls into in terms of risk of spreading the disease. And it also provides you with measures that you can take in order to open in a safe way when the time comes for you to open or to expand. And so I would really urge business people to go to the covidwaco.com site and look at that. I found it very helpful to look through those materials.
Okay, the overall response to the shelter-in-place order and all of the other protection measures like washing hands, covering your cough, social distancing by our citizens of McLennan County has really been working based on the small and few numbers of new cases being confirmed. As we continue to open more and more businesses and allow large gatherings like graduations and the like, what do we tell our citizens to help prevent a return surge?
Well, I know I sound like a broken record on this, but it's the new normal. I mean, we've got to continue to keep our distance, to wash our hands, and to wear face coverings. If we do those things, if we all do those things, we can prevent a surge while reopening our economy. But if we get lax because our numbers have been low so far, we will see that surge, and that's just something that none of us wants to have happen.
Okay. Face coverings have not been required, but highly recommended. I see a lot of citizens wearing them, but many are not. Isn't the need to wear face mask covering or face coverings greater the more we allow more freedom of movement?
Dr. Griggs, would you take that, please? Sorry.
Yeah, absolutely. Yeah. The short answer is yes. As we are out and about more, visiting restaurants and doing retail shopping, it is so very important to wear face coverings. We know the virus can travel through HVAC air conditioning systems. We know that that masks can decrease the sort of plume of virus that emerges when a person coughs or sneezes, and can keep those around that individual safe. We know that the virus has an asymptomatic spread, so masks are absolutely imperative. Incidentally, across the United States, 12,000 people are dying each week from this virus. That puts it up there with heart disease and cancer in terms of the weekly death toll. Again, we haven't seen that here because of all that we've discussed. But in addition to physical distancing, in addition to avoiding mass gatherings, in addition to hand washing, wearing a mask is critical. And let me just offer a few little points on wearing a mask. One is it needs to cover nose and mouth. It needs to fit snugly on the side of the face. It needs to be secured with ear loops or with ties. Ideally, it includes multiple layers of fabric, and it allows for breathing without restriction. And remember that kids who are less than 2 years old don't need to wear a mask.
Okay, this would be for you, Mayor. The libraries, zoo, Mammoth site, water office, municipal court, and water office are all still closed. When will these city operations open up?
Thank you, Larry. You know, many of our public-facing facilities remain closed, and we're still evaluating reopening some of those during future phases, partly depending on what the governor says. But a lot of our services continue to be open, such as the municipal court, the water office, the development center, our city hall, and others are available by phone, online, and appointment only as absolutely necessary. Additionally, the drive-through at the water office remains open and has been available since this began, and we're doing curbside delivery at the library of books. The Cameron Park Zoo is a little bit different. We are waiting to see what the governor says about that, but also trying to consult with the American Zoological Association about reopening. And then on the Mammoth site, we are talking with the National Park Service about that reopening, but that date still has not been determined.
Okay, thank you. Judge, this is for you, sort of the same line. The county tax office has opened recently. What can you tell us about the county courts, and will they start having jury selection or holding trials?
Okay, first let me say a few things about the tax office and what we've done. We felt the need to get that opened up and get folks back to work. But so first we went in and looked over the protocols to protect our employees, and have gone through that process and training with them in regards to wearing masks, washing hands, and social distancing. We've also put some freestanding pedestals with plexiglass in front between the client and our people that are serving them. And then we created a line so we could have enough social distancing between individuals. I would ask the public when they come to the tax office, because many times there would be a line, and that you wear a mask. All of our employees wear a mask as they're serving you as well. Trying to get the judicial system back rolling again is a real challenge. We have a tentative date of June the 8th, but the Office of Court Administration has not come to agreement on all the protocols yet, and so we're waiting on that. We've got a lot of suggestions and ideas, but when it gets down to is it's hard to put a jury together and not have them sitting right next to each other. So we're trying to go through the process of kind of the choreography, if you will, of how you come in and to the courtroom, serve as a juror, and keep everyone safe. So the other challenge to it is going to be what is the confidence of the people that get the notices? Are they going to have enough confidence to come for the jury selection side? We hope so. We're going to put a lot of information about what we're doing to protect them. And, there's a group out there that want to serve and to help out, be contributors to a community. There's others that look for excuses not to. Well, this is going to open up that big excuse door pretty wide. So hopefully we'll be able to impanel juries, but we'll know more as we get into that.
It's been reported that over 630 applications have been received for the local Small Business Emergency Relief Fund that the City Council and Commissioners Court established. What is the status of all those applications, and how many will receive funds and when?
I'll take that. As of noon today, we had a total of 706 applications, a little over $2 million requested. We have gone through and culled out the duplicate denied and no contact information given on some of these applications, and that gets it down to about $1,836,000. The funding committee met last Friday, and notification of payment of the first round of awarded fundings are being delivered this week. That amounted to just over $66,000 that will go to 32 businesses. The next round of awards are expected to go out next week or the following week. We are working through these applications as our staff is working through these applications as quickly as they can. They're doing a great job. I appreciate the work that they're doing. And, we think that by the time we go through all these applications, we may actually have enough money to fund all of these that are appropriate. But we still don't know the answer to that yet.
Okay. Earlier this week, it was reported that the city's sales tax receipts for the month of March were down by about 6% over the previous year. Although that is less than many cities across the state, economists expect April's report will be considerably worse. What can both of you tell us about the impact of city and county services with the reduction of sales tax figures?
Well, we had a budget and audit committee meeting yesterday and got into this in some detail, but it is still so early in the process in terms of being able to tell people what services will have to be cut. There certainly will have to be cuts. We will have a balanced budget, as we always do, but it will be a smaller balanced budget next year than it is this year. Judge, do you have anything to add to that?
Well, I think we're looking at it the same way. Of course, our county is growing, and so we have to provide more services. So it's going to be a challenge. But we've sent a pretty direct message through the ranks and telling them that they need to be really tight on their budget when they come to the budget committee in Commissioner's Court in the next few months. So we've had to get chinchy before, and we can do it again. And so we're going to make sure we have a balanced budget, and it's one that the community, I don't think, will question that on the decisions that are made by the court.
Yeah, Judge, and I should have added, and I know you're in the same position. I mean, we were financially in good shape coming into this crisis, and have good reserves, and I know you all do too at this point. We're in very, very good position compared to a lot of cities and counties around the state and around the country for sure. So we will get through this just fine, but it's going to be a challenge.
Yeah.
Let's ask one more question, and then let's move to the press that's on the phone.
Okay, let me see here. Well, this is the next one in line, and I think we've talked about how the citizens have done such a great job of helping us get the numbers low. What can they do to help get our local economy going?
Judge Felton, will you take that?
Yeah, well, I mean, the best thing you can do is buy local. And, one of the things, and I just know in my case, travel's been limited. We didn't spend the money that we would normally spend on an average day, an average week, an average month through this time. So, let's reach down and pull some of that money out and start spending it in this community and spend it local. I mean, we have got some excellent businesses that are owned and managed here in McClendon County, and let's help them survive. It's more important that we help our own than it is anyone else.
Mayor, I have to just ask this one more question before we go to the other one. I noticed that you and the judge both have gotten a new haircut. And I know you had indicated you were probably going to be one of the first ones in line, in which you were. So when you went to the shop or salon or wherever you got your hair done, tell us the experience of how you think the industry that had been waiting so patiently, longer than a lot of the other ones, how they were handling the what they were expected to do and how they were reacting. What are your responses to that? And you can answer that too, Judge.
Yeah, Larry, I did get my first haircut on Friday since this thing started, contrary to what somebody was apparently saying on Facebook last week during our press conference. My daughter reported that I was being accused of having a haircut. I did not. But yeah, so I did go in on Friday, made an appointment. I was the only one in the room. Fortunately, the lady that cuts my hair, she's an old friend of mine, but she has her own shop and has her own room. So it was very safe. I wore a mask almost the entire time that she was cutting my hair. She wore a mask. I only took it off so she could trim my sideburns. It felt as safe as it could be. For considering how close you are to that person, I don't know how she could have done it in any more safe manner. Judge, you have experience.
Judge, do you have a response to your experience?
Yeah. Well, of course, I was, I guess, maybe a little bit concerned But I was assured by the operator that, that I'd be in a single room. And when I walked in, I had a mask on as well. And she had a mask on. And so once I sat down, the nerves went away and I did what I always do. When I get a haircut, I dozed off. And next thing I knew, I was out in the parking lot and I was money. But anyhow, they have really done a good job. They understand they need to impress their clientele by their safety. And so it used to be, the service and the quality of work, but now it's also the health safety issues that they understand that. So I'm confident our folks will really do well in this.
Mayor, I'll turn it to you now for the media calls if you like.
Sure. Okay. Thank you, Judge. And thank you, Larry. We have 4 media representatives on the phone. The first question would be from Drake Lawson at KWTX, and then Emily Kay at KWKT. KWKT will be next. Drake?
Yes, sir, Mr. Deaver. I have a question for you and probably Judge Felton regarding property tax values. We have had a lot of people calling in and telling us that their property tax values have gone up. Can this be attributed to COVID-19, and do you guys have any comment about that at this time?
Yeah, I can take a stab at this, and then if the judge wants to add on, you're welcome to. No, it doesn't have anything to do with COVID-19. I mean, this is the process that the appraisal district goes through every year. They're on their normal schedule, and they have, this is not something the city or the county controls. It is controlled by the appraisal district, which is an independent agency. John Kennard, one of our council members, sits on that board, and he has talked to us repeatedly about the steps that they have tried to take with the state to either freeze the values at last year's values or some other measure to give relief to property owners. The governor has said that he cannot do that without an act of the legislature. And so we don't know of any method to get relief for that at this point, except to go and protest your appraisal if you don't think it's right. And that's the best that I can tell you at this point. Judge, do you have anything to add to that?
Well, values were up depending on whether they were commercial or residential, but I've seen numbers from 4.5% to 6.5%. In there. And just remember, those values were based on January 1 when the COVID-19 situation was not even around. So, but part of the process of the appraisal district is to go out and do professional appraisals, compare to have comps or comparables and look at those. But the other part of the process is real important, and that's the people that they do not think the value should be that high, and they go and make a case for what they think the value is, and that's part of the process. And you should feel comfortable in doing that. And so it's just part of how it all works out. And it's not perfect. It's and people don't like to go down there, but they also want to protest the value. So. Learn, don't go down there without studying it and really understanding it, and kind of put yourself as an appraiser, look at comps yourself, and be educated when you go down there, or have someone with you that can help you out.
Yeah, Judge, I would say that, you can protest online, which is an important step that you can take right now during COVID-19. That's what I do every year on the properties that I think are out of whack. A lot of times I don't disagree with the appraisal, but when I do, I certainly challenge it. So our next question will be from Emily Kay, and then Carl Hoover at Waco Trib after that. Emily?
Hi, thank you. Now that antibody testing is becoming more available here in Waco, do you recommend that people get tested, and would that be beneficial for Waco in the end?
Dr. Griggs, will you take a stab at that?
Yeah. Emily, antibody testing really has a very small niche role right now, and that is due to the quality of the antibody testing. if there is a high suspicion that a patient has COVID-19, then an antibody test has some value, may have some potential value. If, though, it's somebody who has a middling, sort of a 50-50 or less likelihood of actually having COVID-19, then an antibody test runs the risk of giving you falsely positive information. So that's really concerning if an antibody test is giving someone some sense of confidence that they've been exposed to COVID-19. Now they're immune to coronavirus and can go out and about. If they're under that impression that they're now immune to the virus, and the truth is that's based on inaccurate information, wrong information, then they unwittingly expose themselves to the disease. So again, the niche role only in those for whom the clinician has a very high suspicion that someone has COVID-19.
Thank you, Dr. Griggs. Next question will be from Carl Hoover and then Andrew Moore at KCEN. Carl?
Yes, we're both the city and the county deferring to the governor's lead in which businesses would be opening and which, changing capacity of some of these things. Are local law enforcement and county law enforcement, will they be the ones responsible for any citations for the violation of the state rulings or the state suggestions on that?
Well, Carl, I'll say that, I'm extremely grateful to the businesses in Waco that have complied with the governor's order, and that is the vast majority of those businesses. Inside the city, it is a combination of code enforcement and Waco police who respond to a complaint that a business is open that shouldn't be open. And fortunately, we have not had to do very many of those. Judge, what about for the county?
It's been the same. Of course, most of the businesses are in the cities, but there has been a few complaints, which we check it out. Our preference is to go in and try to educate, be sure people understand what the governor's orders are. It's new to everybody. This disease, this virus is not anybody in this county's fault. And so we're trying to just work through it. And so trying to get people to cooperate. And on the most part, they have done that.
Okay. Andrew Moore at KCEN.
Yeah, hi, this is Andrew Moore. I was also asking about the, number one, the antibody test, and then what other tests are available, and do you anticipate more of those to be available in the future? I was told one of the benefits of the antibody tests was it could show you somebody had the virus at some point in the past, even if they are not currently showing symptoms. Do you not trust the accuracy of that right now, or would that be something useful? And then how many tests do you think that the county is going to be able to do a day in the next few weeks? Is it going to be 130, or is it going to increase more than that?
Dr. Griggs?
So there were maybe three questions there. I'll see if I can get to all of them. The first question was just about the different kinds of tests. The PCR is a viral test. That's the nasal swab test. That test, when it's positive, it's true. If you get a positive result on the nasal swab test, you've got the virus. It unfortunately has a false negative result rate that is also unfortunately higher than we want it. So it's at worst, it's probably 70% accurate in terms of its positive results. So that means a 30% false negative result, and testing is getting a little bit better, and so it may actually be closing in on closer to only a 10 or 20% false negative rate on the viral testing. Antibody testing, it's getting better and better, but we're still not there yet in terms of it. predicting in an asymptomatic person, a currently asymptomatic person, whether that person has been exposed and has developed antibodies. There are early, now these aren't the finger prick tests, but there are serum tests that are showing promise about being able to demonstrate immunity in an accurate way, but it's just too early right now, and it's not ready for prime time use for that function. There is a genetic test at MIT. It's called CRISPR technology. It has the potential to be very cheap and very accurate, but it's also very early, and so it's got to go through a manufacturing phase. And then there's early antigen testing, which is something like the traditional flu test that is also very, very early right now. But there is a product that is coming to market. It may have actually already arrived to market. I don't know the specifics about, though, it's the test dynamics. So stay tuned. And then how many tests in our community in the forthcoming weeks? It depends on how many people come to clinics with symptoms. So if we start seeing more symptoms, we will start doing more testing. Right now, from what I understand, from my health colleagues and at the other systems, really the limit in terms of number of tests that are performed are those who are seeking care. So if more people start coming into primary care clinics saying, I have a new sore throat and chills, or more people coming in saying I've got cough or shortness of breath, then there will be more tests. And I think that answers all three of your questions. I may have missed one.
Yeah, and in addition to that, Dr. Griggs, the fact that the hospitals are now doing testing on all patients before they do elective surgery is also driving the testing numbers up, which is a good thing. It seems to me,
Yes.
from a public health standpoint as well.
Absolutely.
We'll go back through and take one more round of questions quickly from Drake Lawson at KWTX.
Yes, sir, Mayor Deaver. We have another question for, I think, Dr. Griggs would probably be best to answer this one. Just regarding the numbers that you guys were showing today when you have been releasing that's on the website, active cases here in McLennan County, pretty low right now. A lot of, things going down on the charts. But as Dr. Griggs, you said this a couple of weeks ago, ebbs and flows is what we're going to see with this virus. So should we expect to see an increase in the virus in the coming weeks? And should people be discouraged if they see an increase in the number of cases in McLennan County?
If we see increased cases, the mayor started off talking about the positivity rate or the number of positive results over the overall tests. So if we start seeing the positivity rate go up, or if we see more hospitalizations, those are probably the most important markers. The total number of cases may reflect an increase in testing as we test more and more. So that positivity rate norms for the higher number of tests by using that total tests as the denominator. Should people feel discouraged? I think, Drake, that we all, again, we didn't invite this virus. This is not caused by any bad behavior or failure of virtue. This is just the sort of the ecology of germs that have now invaded. And so our only response has to be vigilance. We don't really have any other option right now. And so when we see upticks in positivity rates or hospitalizations, and I suspect that we will, when we see those, yes, we need to be concerned. We need to really be even more vigilant about our health behaviors and be very, very careful. Because again, we all want to be a part of the health and not a part of the disease in our behaviors.
Thank you, Dr. Griggs. Emily Kay at KWKT, do you have another question?
Hi. I know the governor hasn't quite said that he's making masks mandatory, or if he will make masks mandatory as people start to move around more, but is the city of Waco considering making masks mandatory in this situation?
No, we have not. We have talked about that a little bit, but I do not see that coming. At this point, the governor has said that he would not allow us to enforce that, even if we were to order it. And I think, I would love to see some of our businesses start to require masks. I think they are doing that in other parts of the state, and especially the crowded places like big box stores and grocery stores would be great if they would somehow require their customers to wear masks. But I think from a government standpoint, it always seemed like a little too much to Judge Felton and me to require masks, but we so strongly urge people to wear them when they're in those situations. Carl at Waco Trib.
No more questions.
Okay, thank you. Andrew at KCN, do you have another question?
I was curious if there's no other. I was curious if there's going to be a way to test people who are asymptomatic currently. It seems like if we see most of these tests coming from people who have coming forward as having certain symptoms or going into surgeries or something like that, will there be a way to detect the other part of the population that could have this but could be a carrier and could be showing no symptoms?
Well, the tests that are being given on the people that are coming in for elective surgeries are, for the great majority of those, are asymptomatic. But Dr. Griggs, can you take that further?
Yes, since we're starting in those patients who are coming in pre-procedure and are being tested, we're starting with a low probability, and so we can tolerate the very, very small chance that one of those people with low probability have a potential false negative. And so these are, again, the viral PCR tests. So because we're starting with a low probability, it's an acceptable false negative rate using that viral test. So that's the nasal swab test that we're using in pre-procedural settings. There in research testing, there are antibody tests that are sufficient for evaluating whether someone has had exposure, but those are not used yet in the market for patients on a regular basis. But we expect those to be coming fairly soon. And those antibody tests for asymptomatic patients will be likely able to show if a patient has been exposed and has developed antibodies against the coronavirus. So,
okay, I want to thank the media people for asking those questions. And now to wrap up, I'd like for each of you all to provide us a closing statement of anything that's still on your heart or mind. Dr. Griggs, let's start with you.
Well, again, as we said before, this is a marathon, not a sprint. If we are going to continue to see those hard-earned wins that we have seen in round one, we all share responsibility. I think that I'm really proud that we have the freedoms that we have as a country and as a community, and I think that those freedoms come with a certain measure of responsibility to each other. If we're not going to be like some of these other countries that have enforced very harsh restrictive laws in order to constrain the disease, then we have to keep all of us feeling like we're going to be responsible to each other out of our own free will, going to take care of each other and stay at home when you can and keep physically distant and wear a mask. This is, and we'll do it. We'll do it not because some big government force has made us do it, but we'll do it because we sincerely care about each other, and we want to take care of those who are aging adults and those who are chronically ill, and that's why we'll make these choices.
Judge Felton?
All right, speaking of aging adults.
I didn't mean it that way.
I'm including you in that too.
Thank you. Well, you and I are the same age. We've already talked about that. So.
Yeah, and so thinking about that part of our population is really has more at stake in this situation than others do. So, I would really think about continuing to do things like curbside and home delivery and those things. Try to stay out of those very busy retail areas if you can, and wear a mask and then try to be in places if you have to be in places where the preponderance of the people are wearing masks as well. One thing in the shelter-in-place situation that we've been in that has really not been on the radar, but it is part of public health, and that's mental health. And we know that there's indications that that's something that's raising its ugly head in times like this, and so our community is going to have to get our arms around that as well. Our mental health, mental retardation group is doing a great job. They're collecting a lot of data on it. I know through my office on emergency detention orders and all are up some, which indicates that there's more, there's more situations with domestic violence in the homes and those things. There's also the people that are what I would call functional alcoholics or functional drug users, but they have a job and they're doing good, and then all of a sudden they've been at home for a while, and then they kind of switch roles and how they act every day, and so that those are things that either it can be temporary or permanent situation going forward that we're going to have to deal with. But be responsible, shop local, say no to Amazon, and you don't need that because all of our retailers they have curbside, they have all kind of ways to shop here locally, and the dollars that we spend here come back in multiple dimensions, and so we need to maximize that, and that'll help us get financially or economically healthy quicker. So everyone stay safe and be careful and read a lot and pay attention. Thank you.
Mayor?
Thank you, Judge. Thank you again to Judge Felton and to Dr. Griggs for joining us here today. They bring such important information every week, and it is very valuable to me. I hope it is to you too. I want to refer you again to the covidwaco.com website. There is so much information there that can help you with your business, with your personal situation, help you understand better the things that Judge Felton and Dr. Griggs and I are looking at on a daily basis. I want to say thank you to our citizens who have done such a great job so far of abiding by the orders and the guidelines to keep our community safe. And I want to thank the businesses again who have stayed closed in compliance with the governor's order and our orders. I know that is very difficult and very frustrating in many cases, and in some cases it's devastating, and I understand that. It has been a necessary evil up till now for the health and safety of our community. And hopefully relief is coming from the governor in the next couple of days. But just thank you for what you've done so far. We must stay vigilant and not let our guard down, as we've said so many times throughout the day today. The virus is not going away. It's not going away with summertime. It may be reduced somewhat during the summer. But even if it is, we will expect a resurgence of it at some point. We've talked a lot about face coverings. I wear a face covering like this. It's a fishing buff or neck gaiter that I just pull up over my nose and mouth when I go into a busy place. And that is not to protect me. It is to protect you from me. Even though I feel great, I can feel great and have the coronavirus and be spreading it around the community. And that's the thing that is so insidious and so difficult to deal with in this disease. So please just take the time and the effort to put some kind of face covering on when you're out, especially in a crowded public place. I want to ask you to continue to take care of yourself and take care of one another. We're going to get through this together. As Dr. Griggs said, it's a marathon. It may be an ultra marathon, but we're just going to have to continue to work through this together if we're going to make it work. Thank you and have a good day.
Thank you all for being with us. You all, I don't know if you get the information I do, but I have people tell me all the time they really greatly appreciate these informative sessions. And I know it takes a lot of work on y'all's behalf as well and time. And I think the message is clear to use your face mask, and I've got mine here and I'll do that. And I thank you for being with us, and I thank you all for joining us today too.